Now to talk more about this, Sarah Crawford, virologist and professor of biology at Southern Connecticut State University. Professor Crawford, thank you so much for being with us.
My pleasure, Emily.
So I think you just saw in that unscientific poll, there is still some hesitancy from moms and dads about getting their 5 to 11-year-old children vaccinated. What do you have to say to those parents who are still hesitant about going forward with this?
Well, you can understand their hesitancy. Everybody is hesitant when it comes to their children, more so than for themselves. Also, throughout this pandemic, children have been less affected than adults overall. That may bring into question whether or not, in some people's minds, a vaccine is necessary. Nevertheless, the rates of childhood infection with COVID have gone up substantially, particularly since September. And we don't know what the winter will bring. And we know that although the clinical trial was somewhat limited for the Pfizer vaccine for children in this age range, overall, the results were fairly consistent with the side effects that were observed for every other age group. So there's no cause for concern that really jumped out from this study.
Professor, I want to get to a couple questions from our viewers. We have been inundated, thankfully, with people reaching out to us and really wanting answers. So here is one of them from Mike Johnson. He says, is there long-term data on the effects of the vaccine on children? I know you touched a little bit about that, but if you could touch on it a little more.
Well, very honestly, no. There's no long-term data on anything in this pandemic. We are going through it and studying it as we go along. All I can tell you very honestly is that approximately 3,000 children were tested with the vaccine. That's a fairly modest number. No unusual side effects were observed. We still don't have the answer on myocarditis because the rates were so low in older young men that we can't really extrapolate to the small number of individuals tested. So for children who are at risk, have pre-existing medical conditions or immune system sensibilities, these children probably should be vaccinated, definitely, without question. But for most parents, it's going to be a risk-benefit analysis. There doesn't seem to be much risk. There seems to be a lot of benefit, but the jury really isn't in. We can't take a lens of 10 years and look backwards to see what all of this actually means in the long term.
Absolutely. It makes a lot of sense. Before we let you go, we've talked a lot about parents and easing their stress. What about kids who may be also worried about getting the vaccine?
It's really hard. I mean, I think that children are so much more aware than they've ever been before of vaccines. And I think that if a parent makes a decision that this is a good thing for their child, then they should be as positive as possible. If a parent decides maybe in this particular case, for personal reasons, they should wait a little longer, they should explain to their child that even though kids may get COVID, most kids don't really get very sick at all. So you want to calm children's fears. You want them to feel comfortable in their environment. And whatever you decide, you want them to know that you're looking out for their best interest. And hopefully everything is going to turn out really well now that more children will be vaccinated and their overall safety will be protected.
Absolutely. You are very reassuring and you gave us some great information. Professor Sarah Crawford, thank you again for being with us.
Thank you so much for having me.